Welcome back to Fox 8 News in the morning. So there's new research that shows plasma from recovered coronavirus patients could help treat ill COVID-19 patients, but there's an urgent need for this type of plasma. Dr. Simon Muka is leading the convalescent plasma study at the Cleveland Clinic, and he joins us now to explain how the treatment works. Doctor, thank you for being with us this morning.
Good morning. Thank you for having me.
Well, first tell everybody at home what the convalescent plasma study is doing.
So convalescent plasma refers to plasma from patients who have had COVID-19 and have since then recovered. We believe that this plasma contains antibodies that might attack the coronavirus and help patients who are critically ill recover sooner.
And how can a transfusion help a severely ill patient?
Well, we believe that the antibodies in the plasma that is from patients who have recovered may directly attack the virus and help the immune system of those who are acutely ill overcome the infection.
What are your thoughts on the resurgence of this virus in the fall? This obviously, if this happens, it's going to help with that.
Absolutely. We're obviously learning a lot as we're moving along through this pandemic, and we hope that we learn more and have the opportunity to use convalescent plasma as it becomes available. It certainly may be something that is helpful if there is a second wave, which we cannot predict, and that's why we're reaching out to potential donors so that we can have enough plasma available to treat those who need it.
And some of our viewers may be a potential donor for this type of plasma. So what are the requirements for those who are interested?
Anyone who has had COVID-19 and has a confirmed infection, this is either by the PCR, the nose test that some of you may have had, or an antibody test that confirms that the patient had the infection, and they have fully recovered and have no symptoms for the past 14 days, is a potential donor.
Okay. Talk about donating blood or even plasma during this time. I think some at home are probably worried, first of all, about getting out with things reopening, but going into a place like this and giving blood or plasma, is this safe at this time, especially during a pandemic?
I think in general, I think you raised some important points. I think it's still important to continue to practice social distancing and stay vigilant. I think the American Red Cross and other blood centers who are doing blood drives and having blood donations done are very diligent to be safe. I think their locations are usually safe. I think as long as the donation can be done with the appropriate distancing and appropriate hygiene and face masks, I think is certainly a safe thing to do.
All right, Dr. Simon Muka, he's with the Cleveland Clinic, obviously in charge of this study. So we thank you for all you're doing right now. We know you're very, very busy.
Thank you very much.
All right, thanks, Doctor. All right, well, coming up on Fox 8 News.